is Elena Zidaru, and I am a registered dietitian with the Community Health Center here in San Francisco. Today, I would like to talk to you about vitamin D and why it is important to have an adequate level of vitamin D in our blood. Vitamin D is known as the sunshine vitamin because it is synthesized in our skin through UVB light exposure. While it is well known for healthy bones, vitamin D has many roles in our body. Indeed, vitamin D is important for bone health, mainly because it helps with calcium and phosphorus absorption, which are two minerals essential for bone growth. Over the past few decades, science-based evidence suggests that inadequate vitamin D is associated with heart disease, blood pressure, respiratory illnesses, depression, and cancer. For example, there is a correlation between low levels of vitamin D and increased risk of certain cancers such as breast, colon, and bladder cancer. Although the exact role of vitamin D is not clearly understood, we know adequate blood levels reduce the risk of these diseases. But what is the right level of vitamin D? On this point, there is some disagreement in the medical community. The test that accurately assesses vitamin D is called 25-hydroxy-vitamin D and is usually measured in nanograms per millimeters of blood, or ng per ml. Institute of Medicine, IOM, a nonprofit arm of the National Academy of Sciences, estimates that a vitamin D level of 20 ng per ml or more is adequate for bone health, and lower than 20 is considered deficient. However, the Endocrine Society, the professional organization of endocrinologists, recommends a higher minimum of 30 ng per ml. If you've never tested your vitamin D blood level, or you haven't tested it in several years, ask your doctor to have it checked when you're due for labs, and if needed, consider supplementation. Discuss with your doctor what would be a good level of vitamin D for you based on your risk factors. But what is the right level of vitamin D in the blood? On this point, there is some disagreement in the medical community. The test that accurately assesses vitamin D is called 25-hydroxy-vitamin D and is usually measured in nanograms per milliliter of blood, or ng per ml. The Institute of Medicine, IOM, a nonprofit arm of the National Academy of Sciences, estimates that a vitamin D level of 20 ng per ml or more is adequate for bone health, and lower than 20 is considered deficient. However, the Endocrine Society, the professional organization of endocrinologists, recommends a higher minimum of 30 ng per ml. If you've never tested your vitamin D blood level, or you haven't tested it in several years, ask your doctor to have it checked when you're due for labs. And if needed, consider supplementation. Discuss with your doctor what would be a good level of vitamin D for you based on your risk factors. The lack of sunlight in the winter months put residents of the San Francisco Bay Area at risk for vitamin D deficiency. In addition, the use of SPF products decreases vitamin D production. However, wearing sunscreen is essential in reducing the risk of skin cancer by about 40–50%. The skin's production of vitamin D maxes out with small amounts of sunlight, and all SPF products allow sunlight to penetrate the skin, so the benefits of sunscreen outweigh the risks to vitamin D production. For nearly all essential nutrients, food is your healthiest source. However, vitamin D may be an exception, as there are limited number of options that will ensure adequate levels. These include fatty fish like salmon, mackerel, and tuna, egg yolks, cheese, some mushrooms, and some fortified foods like milk, cow's milk, and non-dairy milks and cereals. For these reasons, many people need to take a vitamin D supplement in order to maintain an adequate blood level. If you take a supplement, keep in mind that vitamin D is a fat-soluble vitamin and is better absorbed when taken after a fat-containing meal. The daily recommended doses of vitamin D is 600 international units per day for adults 70 and younger, and 800 international units per day for adults over 70. If you wonder how much vitamin D you get from foods, here are some examples. 1 large egg yolk provides about 40 international units. 3 ounces of salmon, about 450. The ounce of canned tuna about 150 international units, and a cup of fortified milk provides between 115 and 125 international units of vitamin D. Thank you for listening, and I hope the information I share with you today on vitamin D will benefit your health.